Hi, I'm Dr. Lisa Bagnall from We Teach Nursing. Don't forget to follow me on my Facebook page, We Teach Nursing. Let me know if you have any questions. Today we're going to talk about normal sinus rhythm and sinus dysrhythmias. We're going to talk about the normal intervals again, just like I did or left off in my first video where we talked about the basic principles of electrical conduction in the heart. With normal sinus rhythm, we still use this formula for every rhythm. This is no exception. Is the rate normal, slow, or fast? In this case, we have a heart rate of 80, so that's normal. Is it regular or irregular? So if you took a pair of calipers or you had a piece of paper and you put it underneath of these, the first three or four QRS complexes, and you drew a line on the top of each on your piece of paper, and then you marched it down, you would find that these QRS complexes are equally distant from one another. Therefore, it's regular. Are there any P waves? And these are the P waves. Remember, everything should start and stop at the isoelectric line or the baseline. And they should be nice and rounded, and they are. Is there one for every QRS complex? And yes, there is. What is the PR interval? Try to find where the P wave begins on one of these large lines or where the QRS begins on the large line for here, and count backwards if you need to. But anyway, the beginning of the P wave to the beginning of the QRS complex is known as the PR interval, and it should be 3 to 5 boxes wide, or 0.12 to 0.20 seconds in time. And here we have 1, 2, 3, 4 little boxes from the beginning of the P wave to the beginning of the QRS complex. 4 times 0.04 equals 0.16. That is normal. The QRS complex, is it wide or narrow? Narrow QRS complexes are less than 0.12 seconds in width or less than 3 boxes in width. And here it's about 2 boxes in width, and that's about 0.08 seconds. So that's good. That's narrow. The T wave, does it begin and end at the isoelectric line? Yes, it does. The QT interval here is the beginning of the Q wave, or QRS complex rather, to the end of the T wave, and it should be less than 13 boxes wide or less than 0.50 seconds. So if we find a QRS complex that starts near or on a dark line, here it is, that's 0.20 plus 3, 0.32 seconds in width. That's less than 0.5, and that is good. Now I do want to mention there is a QTC interval that is even more significant than just QT interval. And a QTC interval is the same thing, except it's adjusted for the patient's heart rate. That should be never longer than 0.44 seconds. But if you just look at the QT interval, if you can't remember that, and it's less than 0.50, that should be adequate unless you work on a specialized cardiac unit where it requires you to look at the QTC as well. This here, because everything fits in the criteria for normal sinus rhythm, including heart rate, it is known as normal sinus rhythm. Now there is a phenomenon known as sinus arrhythmia, and it's extremely common in younger people, and for most people it's benign. It can be normal, but rather than having a steady rate, the rate varies by more than 10 beats per minute. There is respiratory sinus arrhythmia and non-respiratory sinus arrhythmia. For the most part, respiratory sinus dysrhythmia is a gradual increase in heart rate during inspiration and a gradual decrease with expiration. So you have to observe the patient's breathing and look at the EKG rhythm to determine that, if it's respiratory in origin. Non-respiratory sinus dysrhythmia is usually more serious, and it can be indicative of coronary artery disease. And it is a sinus dysrhythmia that is not related to a patient's respiratory rate. And this is what it looks like. It's normal in children and young adults. I have seen respiratory sinus dysrhythmia in older adults, but I've also seen sinus dysrhythmia that was non-respiratory in origin. And again, that tends to be a little more serious, and that's something that I would report to the physician. Here you'll see normal sinus rhythm, and then you see a variation. And then again, if you see an increase in heart rate when the patient inspires, and a decrease when they exhale, then that is respiratory in origin. Now, sinus bradycardia, again, we're using the same formula. Is it normal, slow, or fast? Well, every rhythm strip that you should be getting is basically 6 seconds. We have 4 complexes in a 6-second strip. Therefore, we have a heart rate of 40. Is it regular or irregular? If you were to take your calipers or a piece of paper and put your lines on 2 or 3 and then march it out, you would find that these QRS complexes are equidistant from one another. Are there P waves? Yes, there are. See those? And is there one for every QRS complex? Yes. Is the PR interval normal? It is 1, 2, 3, about 4.5 or 0.18 seconds. We define normal as 3 to 5 boxes, or 0.12 to 0.20 seconds. 0.18 seconds falls within that normal range, so yes. Is the QRS complex narrow or wide? It is less than 3 boxes. Here it's 0.06 or thereabouts, so that's narrow. The QT interval here is about 0.44. That would be normal. Everything is normal except the heart rate is lower than 60. We define that as sinus bradycardia. For sinus tachycardia, again, we're using this formula each and every time. Don't forget to do that. Is the rate normal, slow, or fast? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 12 equals 120. Is it regular or irregular? Again, if you were to march out your marks on a piece of paper, you would find that these are equidistant from one another. It is regular. Are there P waves? Yes, there are, and there is one for every single QRS complex. What is the PR interval? I would say 1, 2, 3. I don't have my glasses on right now, so I'm estimating as we're speaking. So I would say that is normal. Is a QRS complex narrow or wide? It is very narrow. The T wave begins and ends at the isoelectric line, and the QT interval, let's see what that is. Let me find one that starts on, here we go, one that starts right at the line, and it's about 0.28 to 0.30 seconds in length. That is normal. Hey, guess what? Everything is normal except the heart rate is greater than 100. It is 120. That is the definition of sinus tachycardia. Just as we talked about interpreting EKG rhythms using an algorithm that I showed you in the previous slides, which is right here, I want you to always remember these special points. First of all, the treatment of any dysrhythmia depends upon the patient's clinical signs, symptoms, and level of stability. Another extremely important thing to remember is always check your patient first. This includes checking your ABCs, your vital signs, your EKG rhythms, and any unusual signs and symptoms such as dizziness, chest pain, shortness of breath, or just not feeling right. If you initiate the emergency response team or the code blue team, and or the doctor arrives at the patient's bedside, make sure you have the patient's chart pulled up and that the primary nurse, the one who's caring for the patient, is in the room to answer any questions. This is so important because the answers to those questions can oftentimes direct the course of treatment and can save that patient's life. It's also important to remember that when you initiate the emergency response team or the code team, that you have all the emergency equipment in the room. That includes the suction, that the suction is working, that you have the canister and tubing available, that the yank hour suction is there as well, and that you have an ambu bag in place, and preferably the code cart in the room and the patient hooked up to the monitor. This concludes this PowerPoint.